We're happy to see you again. My name is Kelly Goebel. I am the speech therapist and co-founder of Healthcare Straight Up.
And I'm Jessica Henry, occupational therapist and co-founder.
Today we wanted to talk to you a little bit about some of the questions we get really often about dementia. Today we're going to talk about one of the major ones, and that is, I've been treating someone or I've been caring for someone who has dementia for a very long time. What can I do with you that can help me make things a little bit easier? So I'm going to let Jessica start for what occupational therapy can do, and then I will let you know what speech therapy can do.
First off, I get a lot of questions about what occupational therapy is in general, which is kind of like, how can you help me? How can I help someone with dementia? Well, occupational therapy in general for someone with dementia is all aspects of your occupation. So it could be bathing, dressing, grooming. It could be getting in and out of the bathtub, or it could even just be eating or hanging out, doing your hobbies, whatever it is. So if you're noticing, if you've been working with someone for a long time and you think, I know all the things about dementia, you probably know a lot about dementia, but maybe you're too close to it and you think, oh, I did notice that, they're having more difficulty or increased difficulty. So a lot of things like, any extra, or there's something different or off. Those are the things that we as therapists come in and assess that and notice the subtle changes that is the progression of dementia. And we try to make modifications or things to make it easier for you. Or are you ridiculously stressed out by being a caregiver? It's a hard job, so things that we can do to make your life easier. So lots of different things, but that's a couple of the basic ones for occupational therapy. What about for speech therapy?
Well, for speech therapy, we target a lot more about the safety and the cognition of a patient on dementia. I think if you're a caregiver, you know that as the years progress and as time goes on, the dementia gets worse and worse, and not just their physical function gets worse, but also their mental function gets worse. And that's typically the role where speech therapy comes in, right? We're trying to hold on to their independence for as long as possible. And we know that the more confused they get, the more caregiving they require, the more supervision they require, the less independent they are, the more work there is for you. That's not something we really wanted to have happen in any faster of a way than we need to. We can't really control the dementia, but speech therapy can kind of help with putting some safety techniques in place, working with the caregiver on explaining to you what you can do in order to keep your loved one safe and make some suggestions for modifications, in addition to working with the actual patient to get them to try and do some problem solving on their own. Many people believe that dementia can't make any progress in terms of this is just how it is, and that's not necessarily true. Although a dementia patient is going to progress, and that is true, we're not going to be able to get them back to a normal status. We can prolong the things that they have and teach them routines that allow them to complete tasks in a much easier way than what's typically considered if they were going to do it on their own. So speech therapy does a lot of working with safety training, does a lot of pattern training, and then also does a lot of caregiver training in order to allow the caregiver a little less burden when it comes time to actually get things done around the house that should be more independent. So hopefully we allow, as an occupational therapist and a speech therapist, to allow your loved one to age in place, at home preferably, which I'm sure is their preference as well, and keep them there for as long as possible. If you have questions or you need anything else answered, we would love to help. Feel free to either comment down below or see us on our website. We have a forum where you are always welcome to post your questions and get feedback not only from us as therapists, but also from other dementia caregivers who are also asking the same questions. We hope to see you again in our next video. Bye!